Well, what happened was I got a phone call, I want to say December of 2019. I was actually in Harlem, New York, having unlimited mimosas with my friends and was on my way back to Washington, D.C. And my dad called and he was just kind of like, hey, can I borrow a kidney? And I thought he was joking. And then I could hear my mom in the background saying, no, tell her what's going on. And then he said, well, the doctor them said that I may need a kidney and I'm asking you if I could borrow it.
We would like to begin by recognizing that wherever we are in North America and the Caribbean, wherever we are logging in from in North America and the Caribbean today, we are located on the traditional territory of Indigenous peoples dating back time immemorial. We acknowledge these lands, the people, and the treaties in place in North America because the first step to reconciliation is recognizing the first peoples of our lands and our relationships and mutual responsibilities. Hundreds of years after the first treaties were signed, these treaties are still in place today. The power and potential of land acknowledgements allow us to connect with the very rich history of these regions and make it clear that there were first peoples who lived on these lands prior to the enforced transportation and subsequent enslavement of continental Africans and the related arrival of European settlers. We acknowledge the importance of working in stewardship with Indigenous peoples to manage these lands with respect for Indigenous customs and ways. I am based in Hamilton, on the traditional territories of the Mississauga and Haudenosaunee nations, and within the lands protected by the Dish with One Spoon Wampum Agreement.
Those who have gone before us. Over centuries, over generations, our African ancestors arrived on Canada's shores and through Canada's ports, some involuntarily and others willingly. Peoples of African descent and continental Africans, as enslaved peoples, as displaced peoples across Africa's diaspora, and as migrants, we have survived. Collectively, we have made an indelible mark. Despite the horrors of the transatlantic slave trade and over 400 years of enslavement, peoples of African descent have contributed to Canada's rich cultural and economic history. We have thrived. In solidarity, as members of Canada's African, Caribbean, and Black communities, we fight against the impact and effects of structural and institutional racism that African continental and diasporic peoples face every day. In so doing, as African descendants, we honor our African ancestors regardless of origin. Thank you all for being here today.
Hello, everyone, and welcome. My name is Patricia Gongol, and I'm the Executive Director of the Canadian Donation and Transplantation Research Program, or CDTRP. CDTRP is based at the University of Alberta here in Edmonton, and I'm a settler on Treaty 6 territory, the traditional lands of Inehio, Niitsitapi, Métis, Nakota, Dene, Haudenosaunee, and Anishinaabe. Thank you, Mary Claire, for delivering the land acknowledgement. Mary Claire is CDTRP's program coordinator, specializing in communication and knowledge mobilization. And thank you to Charles for delivering the African ancestral acknowledgement, which was written by Dr. Jacqueline Getfield. Charles is an active member of CDTRP and is an experienced patient partner in health research, lending his expertise and perspectives to improve the quality of research and health outcomes for people. So on behalf of CDTRP, thank you for joining us today for the first webinar of our series, Conversations about Health in Black Communities. Tiana and Dennis will share details of their kidney transplantation journey with us. We will also discuss risk factors for chronic diseases and their links to organ transplant and the role of race in health outcomes for African, Caribbean, and Black people. Now, I know you're eager to hear Tiana and Dennis's story, as am I, but I will first take a moment to tell you a bit about CDTRP and why we're partnering with CARM to ensure African, Caribbean, and Black voices are engaged in CDTRP's work. So CDTRP is a national research network, now in our 12th year, dedicated to improving donation, living and deceased, and the long-term health of transplant recipients across Canada. We do this by supporting research that helps the community develop the new knowledge needed for better healthcare practices and better policies. And our network is grounded in deep respect for the voices of those with lived experience. This is reflected in our governance and our structure, namely our patient, family, and donor partnership platform, which includes over 100 patient, family, and donor partners. These are regular people from all walks of life who believe, like we do, that research represents hope that we can make things better, who guide and shape our priorities and our projects. We recognize the inequities and injustices that people experience in the donation and transplantation system on the basis of race, gender, sexual orientation, disability, and other factors. And we are committed to supporting research that will help our system know better and then do better, to paraphrase Maya Angelou. And so we are very pleased collaborating with CARM to bring you this webinar series and spark these much needed conversations. So Istvan, you're up next. Over to you. Please tell us about CARM.
Good afternoon, everybody. Thank you very much, Patricia. I'm Istvan Mucci. I'm co-leading the Caribbean African Regenerative Medicine program together with Professor Carl James and Dr. Jackie Gatfield. Thank you very much for partnering with us to deliver these discussions and conversations about health, organ health and Black health to communities that need this information. First, I will briefly talk about our program, the Caribbean African Regenerative Medicine Program. And then in doing so, I first need to kind of describe what regenerative medicine is. We use this in a broad term to include all leading research and clinical approaches to health and illness. Regenerative medicine uses cutting-edge approaches to engineer tissues and improve organ health, to replace and regenerate failing or dysfunctional organs and tissues. And in this sense, it includes therapies using stem cells and other cellular therapies. And of course, it includes transplantation that we will be talking about, since it replaces organ function. It replaces the function of an organ which is not working. We started to think about the CARM program about 3 years ago. And this was based on a research network's need to engage with communities. And this research network was the Medicine by Design program, which was a large regenerative medicine program. They realized that the information about these leading technologies and leading treatments for conditions that are very frequent in different communities, including ACB communities, the information is not quite readily available for communities, and there are concerns and lack of recognition of these treatments. On the other hand, research and clinical communities don't really know too much about what communities think about their health and illness, what is their needs about these conditions. So we hope to build bridges between research and ACB communities and bring information in both ways. We have a group of researchers who work on these objectives, and these discussions, like the conversation today, are part of our mission and part of the work that we're doing, together with a fairly big number of students from mainly from ACB communities who work with Dr. Gatfield and Professor James on researching conditions, understanding communities' needs, and delivering these informations. Briefly, I would like to introduce Dr. Gatfield, who is our program manager and who is guiding this student group who is working with us on these questions. Dr. Getfield graduated from Ryerson University, which is called the Toronto Metropolitan University now. She was born in Jamaica and worked in broad areas of communication. Initially, she worked as a broadcaster and in public relations, and then moved to Canada, and then she got into research. She did qualitative research on mothering and health and education and disability. And she focused on Blackness in these areas and how Blackness manifests and how you as a Black mother navigate these fields. Since 2023, she has been the program director of our CARM program and has been working with students who are themselves quite passionate about the questions that we are discussing. And currently we have more than 20 students, as I may have mentioned. And at this point, I will hand over to Jackie, and hopefully the program will deliver useful information for everybody. Thank you very much for joining, and please feel free to ask your questions later on.
Thank you so very much, Isfan. I really appreciate the introduction. I'm feeling good today. I thank MC and the planning team. It has been quite a bit of work, but we are here today, and I just want you to indulge me. I just want a little bit of time to just tell you how thankful I am to see so many people in the audience. Today is the first in a series of 3 webinars, but it's the first for many reasons for all of us. It doesn't escape me that it's the first we're talking to a father-daughter organ recipient, organ donor, who are not only Black, not only from the USA, but the father has a background, was born and raised in Jamaica. I want you to sit and think about what I am saying when you think about the statistics of who gets organs, who doesn't, who gives organs and who don't. This, for me, is a big first. So there's lots to unpack, so let's begin. I'll begin first by introducing Dennis. Then I'll introduce Tiana. So Dennis is a man of unwavering faith, deep compassion. He loves his family. As I mentioned, he was born in Jamaica in a tiny, when I say tiny, I mean tiny, a tiny district called Pike in Manchester, Jamaica. He immigrated from Jamaica to the United States in the 1980s, of course, in pursuit of opportunities. In the US, he had a meaningful career as a Master Electrician, faithfully serving the Wellesley College community in Boston for over 35 years. He's married to Vivene and father to Kevin and Tiana. And then Tiana was born in Boston. He's a Boston native and is a first-generation American. Dennis and Vivene brought her up with the values of faith and family and hard work. Tiana is a basketball, collegiate, athletic, healthy eating person. She's passionate about many things, but amongst them is her faith. All of this, I believe, led to her giving the ultimate gift to her father. She donated a kidney. She lives in Maryland right now with her husband and son. And well, let's get this discussion started. So both of you, Tiana and Dennis, thank you. Thank you for agreeing to do this webinar. There is a lot that we're gonna learn from you today. You both are the teachers. Doesn't matter how many subspecialists we have in the room, how many doctors, how many academicians, how many professors, you are teaching us. And who are you teaching? In this room, there are students. There are, as I mentioned, doctors, there are nurses, there are subspecialists, there are patients, there are other donors, family members, caregivers alike. I can't say it enough. Thank you. So how you do? Dennis, how you do? You're muted. So we're gonna have to unmute you. How are you doing today, Tiana?
I'm doing well, thank you. Thank you again for the intro.
You're unmuted now, Dennis. How you do?
Good, and thank you for your introduction. Yeah.
I want to start off first by asking, how did you both arrive at this point? And I'm going to start with Tiana first, only because she's younger and prettier. So tell me, how did we get here, Tiana? What happened?
Well, what happened was I got a phone call, I want to say December of 2019. I was actually in Harlem, New York, having unlimited mimosas with my friends and was on my way back to Washington, D.C. And my dad called and he was just kind of like, hey, can I borrow a kidney? And I thought he was joking. And then I could hear my mom in the background saying, no, tell her what's going on. And then he said, well, the doctor them said that I may need a kidney and I'm asking you if I could borrow yours. So since that day, I'm now tipsy getting on my mega bus going back to DC. From that day, that was the last time I drank for a long time because I said, whether he's telling the truth or not, I'm just gonna go cold turkey until we get to the bottom of what's going on. So that was my initial finding out what was going on with Mr.
And this was when again? What year?
It was December of 2019. December of 2019.
Wow, that was before the pandemic.
Before, correct. So that's why I have to preface it with that.
Wow, wow, wow. So Dennis.
Yes.
I guess you're a jokester. Because I heard that you want to borrow a kidney. How does that work?
Well, I don't know. I'll give it back later.
Okay. Okay, all right. Okay, I hear you. So Tiana, back then, how would you describe your relationship with your dad?
We were close. We are close. We were close. We're a tight-knit family, so when he does make a call like that, even though he's being comical about it, I know that there's some seriousness to it. But yeah, no, he's done everything he could for my brother and I, and for many others. Even though he has 2 kids, he has a lot of people calling him Uncle Dad.
Okay, that makes sense. That makes sense. So you got the call, you sobered up from your mimosas, and it hit you. My father needs a kidney. What did you then do? How did you decide if you were a match? What were the things going through your head at the time?
Well, at the time, I also did process of elimination, whereas there's nobody else in the family that's healthy enough to be able to do this. Daddy then put me in contact with the transplant center just to get just more information. And they did a pre-screen and I realized, I was like, well, my brother can't do it. My mom can't do it. Nobody else could do it. And even if they were able to do it, I knew that I was going to be able to withstand whatever was to come. But I purposely didn't really do a whole lot of research on what was to come because I didn't want to psych myself out from saying, don't do it.
What were the particular fears? You didn't want to do the research, so there must be something there. What were the fears or the myths or the community sayings, or, you know, because by this time, many people talking to you about many different things. So describe those fears, community thinking, what they were saying, what you were feeling.
Yeah,
Even though you didn't do the research.
I didn't say much to people about it. I said, all right, let me just go to the doctors and find out. So I had never had surgery, real surgery before. So that was one. So I didn't really want to know what was going on there. In about 3 months, I was flying from DC to Boston to do all the pre-screening. So they had me with a social worker. The social worker was asking, do you have any, are you okay with getting cut? Will that be something that bothers you, you know, body image wise? And I'm like, wait, why is this even a thing? You know, just even seeing if I was going to be a match because of my size. So at one point, I had to do a urine test to test the viability of my kidney. And that urine test actually failed at first. I still remember when I was capturing the urine, I had an early morning work day, and I had to hold my urine for about 12 hours. And then I know I peed myself a part of it because I was just like rushing to get it done. And it came back as no match. And they called and was like, hey, unfortunately, this is not going to work. And I was like, nah, I need you guys to retest because there's no way. And then I ended up having to go to Children's Hospital in Boston. And Children's Hospital, they looked at me and they said, I know you're an adult, but because of your size, we have to do it like how we would do a child. So they had to stick an IV into my arm to be able to test the viability that way. So when it came to fears, I started thinking, wait, is my body even equipped for something like this? And if this was just the first 3 months, what was going to be coming? And at this point, again, pandemic hadn't hit. It hit right when I was coming back from Children's Hospital. And the world shut down, I want to say a few days later. So that was just the pre-notion there. I had a few people that told me that they knew people who had donated before in the past and, well, who had received in the past. Not a lot of people knew people who donated. They just knew people who always needed something. And what always, what pushed me was the wait list, 5 to 7 years to just get a living kidney. Not a dead one, a living one. So I said, well, I have an opportunity to give my dad a living one because I heard a lot of horror stories about people waiting, even today, people waiting years, living off of dialysis, waiting for a kidney. So that was just some of the pre-thoughts of what was going on.
Before I get to Dennis, I have one more question. This was before you had your son.
This was before I had my son.
Was this before you had met your husband and decided to get married, or were you married already?
That was Dr. Getfield. Okay. So we started talking, we started dating, the courtship, I guess you could say, started. However, I did take this journey seriously. So he knew I was gonna put a pause on my love life, and he was just kind of like, all right, I'll still stick around and I'll be here. And I said, okay, even to the point where even in COVID, he was like, I could quarantine with you. And I'm like, no, you're not.
That man is a keeper. That man is a keeper.
You know what? He's still here, so.
Yeah.
But a big part of it was because of the pre-screening. They wanted to know about sexual partners, and they wanted to know, had you had any STDs before? Have any of your partners had anything? If you do contract something, everything blows up. So I say that to say I intentionally did not think about any type of romantic relationship because I said I wasn't going to jeopardize anything. And I guess I could fast forward even just a little bit, like a week before we did the donation, I had to do another testing. And that's when they told me that I had a slim chance of having a child because of my age, because of not, they were just like, we don't know, the stats are just saying this. And I still remember going home to tell my dad and the whole family. I had a family meeting about it. I said, this is what they said. And Daddy was like, you know what? I don't think you should do it. And
He
I said,
doesn't?
he did not want me to do it because of the chance of not being able to have a child. And I said, well, I can't get another you, but in this day and age, I could buy a child, I could adopt a child, I could, I could have a surrogate. There's a lot of ways for me to have a child, but I can't get you back. So that in itself was probably the biggest one of just like, all right, no, we're doing this for real. Because even though he said, nah, I don't think we should do it, I'm like, no, we're doing it. So I guess those are the biggest points of the testing that were, I guess you could say, yellow, red flags of that could have told me no. Everything else they were just asking, is somebody bribing you? I'm like, no. But then they also wanted to make sure my mental health was going to be a thing, and I'll touch on that later on as well.
Yes. Hi. This is something else. Dennis.
Yes.
You are now a granddad.
Oh yes. Twice.
Oh yeah. Oh yes. Oh yes. Oh yes. Today, Dennis, you are one of two featured speakers. Some could say that you are an international expert on patient experiences with organ transplantation. Dennis Williams, tell me something. Yeah, I guess so. How did your journey to transplant surgery begin? Was it with diabetes? What led to diabetes? And if so, tell us, how did it begin?
Well, I'd say it's diabetes in the first, just because my whole family has diabetes. I mean, my mom, my grandfather, my grandmother, brother, and sister, you know, it's just the whole family. And I mean, you was gonna get it at some time because So I think I get it in my maybe I think I probably was about maybe 35 or so, and I realized because that pain and pain over all the time and stuff. Went to the doctor and it was diabetes. So started. I mean, it was in this early stage, so they didn't do anything. It just so watch you what you eat and stuff. But I love food, to tell her the truth, and I just don't care what you eat. So I you know get worse and worse over the years, and I was on metformin, and then so finally I went to the doctor one day, and then they say, we have to take you off of metformin and put you on insulin because the metformin is gonna mess up your kidney, So, starting the insulin, you know, and then it's you say keep progressing as you go along, the kidney getting worse and worse, and you know, and so finally it comes down to where I couldn't it's just the doctor says, oh, you only get a couple your kidney function is like maybe 2 or 3%, so so they send me to a kidney doctor. So the kidney doctor say, all right, the best thing for you is to start preparing for dialysis. So now they send me to another place where I'm going to do, I have a choice now. So I could get the machine and do it myself at home, or I could go in and, twice a week, so, so they was gonna, I went to school for that to show me all of that, how it goes and stuff. And then he says to me, why don't you sign up to for the transplant too? You know, to sign up for the transplant, because you know you never know. You know, if you know you'll be a couple of years ahead, even if you know. So we did that, and so you know as we go along, and I think I went to the doctor one time, and then I we called Tiana and talked to her about it and stuff, and to borrow one of the kidney, but so we did, and that's how we end up um starting the transplant stuff.
Mm-hmm.
Yeah.
Mm-hmm. Tell me about your thinking. Did you always think that Tiana would be a match? And what if she wasn't a match? What was your plan? What did you plan to do?
Well, once over here, if she agreed to give her the kidney, even if it wasn't a match, then somebody else would match me. They would just switch it. So
Okay.
I mean, I would still get a match. Even if it wasn't her, hers would go to somebody else, and then somebody else who was donating would come to me. So as long as they could find the match, that's what they do here. So once she agreed, it would I would definitely get a kidney.
Okay. I see. Dealing with the healthcare system, Tiana, I am told, because I've never done this, it's like herding cats. First you have to gather the information, and by the time you gather the information from different people, you're already tired. Information coming at you left, right, and center. I have also heard that doctors not only tell you what you must do, but sometimes they don't even listen to you, and so they don't know what your concerns are. This is what I'm told by other patients. Was that your experience as well? What was your experience in gathering the information that you needed pre-surgery? And I know you said you didn't do a lot of research, but I know you didn't go into this willy-nilly. You knew what was going to happen, or what is said will happen. So the question is, what were you told or not told? And in hindsight, is there anything that you wish that you were told from the get-go?
Yes. So going into it, I didn't have to worry about insurance because I was a donor, they said it was going to be taken care of. They're just gracious that I was willing to do that. What I was most so concerned about is that I started a new job right when I was about to. So when I was flying back and forth for the testing, I was working at Howard University, and they were very flexible with me with my appointments. Pandemic happened and I switched jobs. So now I'm working at Southern Connecticut State University, and I didn't have a lot of time. I may have been working 3 to 4 months prior, and they were like, "Hey, I think you could be okay, but we're not sure." So I actually had to do a lot of research on FMLA and what was going to be able to count as FMLA. And the union at that university was amazing, where they were able to find out that
What's FMLA?
the family medical leave absence, I believe.
Okay.
Someone correct me if I'm wrong, but FMLA, you can take time, your job's protected. So that is a protection that they have here in the US for certain circumstances. The union at Southern Connecticut State University did some digging for me because they were like, "Hey, this is a unique situation. Whatever you need, we're going to find out how to make sure that you can get the time off." So they found out that kidney donation was a part of it, and that I would be able to get, I want to say, 3 weeks off. And they said, even if you're not granted, they said, we think you're going to be granted, but we also have what's called a sick bank. And people are able to donate sick time to me because I didn't cure enough. So a new community that I just went to, it was like family from the start. everyone just started saying, Tiana, I've been here for 10 years. I got time. This person, I got time. Like whatever you need, we will make sure that you have the time. So that was a huge lift because I was concerned about that part of not having my job. But the Kidney Donation Transplant Center, they also said, if you run into economic hardship, we could figure out like a small stipend if you are out of work for that. So that was the biggest thing, is just really just job protection. I didn't really have to worry about health insurance in that regard. And then the only thing that they didn't quite prepare me for, which they gave me a blanket, hey, this is what the donors go through. You'll donate in 1 or 2 days, you're right back out the door, and you'll be fine. So that was what they told me before the donation.
And
Oh, you want me to go to post?
oh, not yet.
Oh, I was gonna
that's
say, if you
cool.
want me to go to
Okay.
post, but that's just what in preparation.
Yes.
That's what they said in preparation.
Okay, okay, thank you. So before we go to post, let us touch on the pandemic, because that is in itself unusual. Transplantation is one thing, it has its challenges, but transplantation during a pandemic, I think that is just another experience altogether. So the question is for Dennis. Dennis, where were you at that point in your life during COVID? Were you still working? Had you retired? Where were you?
I was still working. I was still working.
So what was that like going into the pandemic? Well, you didn't even know you were going into a pandemic in 2019, because I think it was about January, February when the world began to realize what was going on. So the question is, when you found out that there is indeed going to be a lockdown, what was your thought process as to what we are going to do, what is going to happen?
Well, I mean, I was still going to back and forth from the doctor and stuff, and the most thing that I was afraid of was, you don't want to get COVID because there's so much people dying from it, and if you do go do a surgery and you get the COVID, I'm not sure if you're coming back from it, so it kind of made me a little bit anxious there, because you just didn't want, you try to be as careful as you can, but that's that's where the thing, you don't know.
That's where the faith comes in.
Mm-hmm.
Tiana, what did this do? Because I remember in Canada during COVID, lots of surgeries were put on hold, especially in the first part of COVID when we didn't know really what it was. So I remember a lot of surgeries, even people with cancer who needed surgery, it wasn't a done deal that they would get the surgery done. So the question is, what was your experience dealing with the hospitals, dealing with everybody that you had to talk to in this entire process? What did COVID do to that process?
Yes, so I was crushed. I'm not gonna lie, because the same day they gave me the results from the Children's Hospital IV, they said, we got good news and we got some not so good news. The good news is you passed, your kidney's viable, we could do this. The not so great news is, because of the world pandemic, this is now an elective surgery and you all are gonna have to wait. And I'm like, wait, no, we were scheduled to do this in a few weeks, because like this was supposed to happen. I had it mapped out. I'm like, all right, I could get this done before my birthday and then be recovered by the summertime, still be outside. But no, like they told me this is a no-go. And I literally had to call probably every month for about 4 to 5 months to see, are we back on? Are we back on? Because the tough part about it was to see my dad's health decline this whole time. Like I'm seeing him barely be able to walk. He's sweating out. He's like doing all the things, and seeing my mom have to take care of him and keep him going while we're in this elective surgery state. So during that time, I actually, like I said, moved back to Connecticut. So I was living by myself in my house in Connecticut, and Boston's only a 2-hour drive, so they would come down frequently to spend time. But as much as I see themselves pushing to try to help me, it was hard to watch his health decline in that part. But the only good thing is I really got to learn even more about my parents during that time. I got to hear all the stories. I got to unlock family secrets. There's a lot that we just had time to have extra bonding. So that was one of the things I was grateful for, but I did not like the wait at all.
So the actual transplant surgeries took place during the pandemic as well, or was it?
It happened November of 2020.
Yeah, right in the middle of the pandemic.
And it was originally scheduled for November 3rd, my mom's birthday. And I already know she was not having it. She did not want to even think about potentially losing both of us on her birthday. So we asked for them to push it to, I want to say, was it November 17th? It was right before the US Thanksgiving.
Yes.
Yeah, right before US Thanksgiving.
We came home a couple of days before Thanksgiving.
Yeah.
What's that, Dennis? Couple days before it. Okay.
Yeah.
So, Tiana, I let me stay with you for a bit. Let me stay with you for a bit. Your positionality.
Sorry.
When I say positionality, I mean who you are, where you went to school, what you do for a living, your race, your class, everything that comes together to make Tiana who she is. Your lived experiences. How did these impact how you were able to navigate this world of organ transplantation during a pandemic? Because I don't think everybody could do it. What is it about you? What contributed to you having the skills, the wherewithal to do what you needed to do? Tell me about that, Tiana.
Well, in a nutshell, people can't see how tall I am. I'm about 5'1", 120. So I'm a small person. And I've always had to prove myself, whether it be from my appearance, in my profession. It's not a lot of Black women. So when this was happening, I was working in the sports industry. So for 10 years, I'm seen as the minority, not because of my skin color, but because of my me being a female and running the show. And that's something that I've always had to constantly prove and have a chip on my shoulders. To now I'm in fundraising. Black women make up 2% of fundraisers in this field. So, and to be a director at that. But what got me through was not only my grit, but my chosen family. Because when I graduated from college, I did not go back home. So my communities in Connecticut and Maryland and DC, like up and down the East Coast, like I'm a part of a lot of different circles, networks, and my friends, my chosen family, they stand 10 toes down for me. So they also helped with the transition, with the journey, and that guy that we mentioned earlier, even though we had just started talking, his faith, even though I didn't know he was the one at the time, but the faith that he had that everything was going to be okay also helped with this journey.
Nice. This journey, this walk is as I said at the top, it's unique. It's not something that we bump into every day. I don't know what the stats are regarding people in Boston in terms of donors, recipients of organs. I don't know what the stats are, but what I do know is that I think it's about 28% of persons who need an organ in the United States are Black. And of course, the percentage of that who actually get an organ or even can donate an organ, it's very, very low comparatively if you compare it to white donors and white recipients. So it made me think about the various things that had to come together to make this happen. And so, Dennis, how did all of this play out in your conversations with Tiana, or did you just step back and just leave Tiana to do the talking and the, you know, do the negotiating and all of what needed to happen? How involved were you? How did, you know, what did you do? What did you not do? Did Tiana take the lead in all the conversations? How did it work?
Well, once she agreed to donate the kidney, I think they gave her a team, so she had her own team, and then so I had my own team to tell me and my own social worker as well as she has, to kind of tell us, guide us where we're going, So I really didn't have to. I just ask her, she'll ask me, You hear from them?" And I'll say no, or and they put it off or whatever. But she do her own thing, in researching her stuff and stuff like that. I just had to deal with my team, and they tell me where I'm going and when or how or something like that. So they had classes, at the hospital where I had to go. Vivene and I had to go, and we sit in the classes, and we'll, other people who waiting for kidney or, donors who came, and sometimes the class is like, 15, 10 people, we can ask questions and they'll, tell you, especially somebody who received a kidney already. Because I had a couple of people in one of the classes that they had, they had received kidney probably 15 or 20 years, and now they need a new one because that one is going down. So they were in, looking up again, and to say this, what back to what Tiana was saying about me saying to her, don't bother with it. After I had this surgery and stuff, I went to see one of my a friend at work, and her husband needed one kidney. So I said, my daughter gave me one. So she says, he says, well, I didn't have anybody. He had two daughters, but he didn't have anyone that could. One was like a little bit overweight, and his sister was overweight. One of the daughter could give, but he says no. He says, I say no because I already lived my life, and that kind of bummed me out because I said, look at what I did, but being, but that's how it is. And he eventually get a kidney, but he's not as healthy as me at all because I don't know if it was a live or a dead kidney, but he's not. I went to see him not too long ago, and he was sick. So yeah.
Oh, I'm sorry to hear. I'm sorry to hear. We'll come back to that at the end. That is a very interesting point you made, but we'll come back at the end. For right now, I just want to delve a little bit deeper into your positionality, who you are. You are a Black man, a tradesman, a master electrician, Jamaican born and bred, a man of Christian faith. That is your positionality as we know it from your bio. That's how you are positioned in the world, Dennis. And that's how people see you and maybe how you see yourself. But I wanted to know, how did you think this through in line with what your friend had said with him and his daughter, with you and your daughter? How did that thinking take place in your head? As when you thought about who you were, who she was, where she was in her life, what is your response to what you said your friend said, in that he wouldn't take it from his daughter? What was your thinking?
Yeah, I know that when he said that, I was just saying maybe I'm selfish because I should have think that, because I really didn't think of it that way until he said it, but that's
This is after you borrowed a kidney and you
yes,
realize no,
yeah,
you can't give it back.
right, yeah, so
Yeah.
yeah, but I mean, I was just kind of bummed out for that, because I said, maybe I'm selfish because I shouldn't have done that, but it's already done, and I can't take it back. I can only say, thank you, and
And
move
take
on.
care of it. And
Yes,
take care of the kidney. But
yes,
I look at it the other way and I say, Tiana is your daughter, but she's also an adult.
yes,
And it is because of the relationship that you both had that you have come to this point. So that is what I'd like to offer in response to that. Tiana, you look like you want to say something. No?
No,
Okay.
I'm just listening.
Okay, all right. So at any point during this process, Dennis, did you feel, or even Tiana, did you feel like you were being treated differently because you were Black, like Dennis, immigrant from Jamaica, all of these things in terms of your race and your social background? Did you feel like this made a difference? Do you feel like you were being treated differently in Boston? At where, I think the hospital you said was Bethesda. Did they treat you, Beth Israel, sorry. Did they treat you differently? Do you feel like you were treated differently?
no, I did not, because whenever you go, you still see Black faces. So you see black receptionists, Black people sign you in and weigh you, and all of that is either Black or Hispanic, and But I really never. I always think that is because we have insurance, and I had decent insurance. So I mean, I think they just see the color of the money. They don't really you know see that if you're Black, or I mean, maybe but that's how I see it, because I really didn't see a lot of racial anything there. I just see that I did get good care, and they did check up on me, and they did call me, and and I had my social worker right up to the time, and making sure, and asking me, you all right, you mentally fit and stuff like that. So I didn't see any kind of racism right there, that could tell you the truth.
Okay. Fair enough. Tiana, what are your thoughts? You are into the thick of things, I believe, because having gone to a historically Black university, because having been born and educated, raised in the United States, maybe you're thinking about racism and how you receive it may be different from your dad's. Is this true? Did racism come to play in the process while you're going through this organ donation process?
No, I didn't experience any blatant racism at all. I will say one thing that this process did highlight was that they were grateful that we were Black and that we were of Caribbean descent that was actually able to do this, because they saw a lot of patients not be able to get a donation that looked like us. There were not a lot of people. So in hindsight, our experience is just adding to the statistics of what it looks like for a Black family. Because that's one of the things that, although it wasn't racism, they didn't have enough data for African Americans and Caribbeans going through this. So even just this panel in itself is so important, because this is going to add to the data to help people who look like us.
Right.
So yeah, no racism. It's just there just needs to be more of our color doing things like this.
Okay. If one were to think about the emotional toll, the physical toll. Again, to think about COVID. When you consider all of that, and I'm gonna get into the post-surgery soon, what could have prevented you from doing this, Tiana? When you consider all of it.
Yeah, what could have prevented me? It could have been like my dad said earlier, if I got sick. So I really like lived in a bubble. My friends knew that they were like, hey, if we're gonna be around you, we gotta get tested, or we're gonna be outside on your porch. Like COVID was not catching COVID was a big thing, but then like I said, I put my love life on hold, not to jeopardize anything. So whatever that pre-screening was, I said, all right, I'm just not gonna do it. So eating healthy, not drinking, like I just fundamentally just shifted everything so that I wouldn't get a no when time came. And it was a long period because you didn't know when that we were going to get the call. It's just, I know I'm approved. So now I just have to maintain this approval.
Yeah, that's tough. That's
Mhm.
tough. Dennis, your daughter loves you.
I know, and I love her too.
All right, let us get into the post-surgery now. You had mentioned something about COVID, and I said, let's talk about it, a little later.
Mhm.
So, Tiana, go ahead. Talk about the post-surgery. Talk about the effect after the surgery. Because, your other cousin, Dr. Getfield, would say the problems are not usually, if you come through the surgery, that's more than half your battle. The real battle is in post-surgery. The real battle is in recovery. What was recovery like for each of you during COVID? Because as far as I know, at least here in Canada, many of us were not vaccinated in November of 2020. In fact, I don't even think in your country you were fully. I think your current president is the only one who got an early vaccine. I remember back in, we're not going down that road. I'm just saying that not many people had the vaccine in November 2020. So what was that like? Surgery and recovery in a pandemic.
Well, I'll say this. I hated getting that test that went all the way up to your nose, because we had to get tested several times that
Yes.
same day.
Yeah.
Going in, and I just remember when they rolled Dad and I separately, and I said, "All right, I'll see you on the other side." And again, I had never had surgery before, so I didn't really know what to expect. Once the anesthesia wore off, I felt paralyzed. I was like, "What is going on?" And the doctor, I was just kind of like trying to squeeze her hand, and she was just looking like, "You should be fine." And for the next 2 days, they said, all right, our goal is to make sure that you could walk. I had a catheter, and they wanted to make sure that I could pass a bowel movement. But after 2 days, I wasn't able to walk. I was barely able to move. I still remember hitting the button saying like, I need more medicine. And they were like, no, you don't. I said, no, I need more medicine. Like, I woke up, I think I called one of my friends at like 4 o'clock in the morning. Like, I can't take this pain because, again, my body makes I think they anticipated. So it just, and then my dad, he was walking up and down, healthy and stuff, and I'll let him tell his story. But I think it wasn't until day 5 that I was able to stand up and walk down the hall. And that stuff is documented. I still remember texting my friends like, "Hey, I'm up," and they were all cheering for me because they all wanted to know what was happening. And part of me was a little like ashamed to not be able to get up, but it was I just had to put mind over matter and really just be able to get there, and just was trying to articulate to the doctors, hey, this is what's happening. And for them to truly understand, because I don't think they really understood, because again, the data shows in 1 to 2 days, you're out the door. So I'll stop there for a second. Yeah.
The question is, and if you want to share, because on my end you cut out a bit. What is it that they thought went wrong? Why yours took 5 days as opposed to 2 days?
They didn't say anything went wrong. They just said, oh, you know, everybody has a different timeline. They said, typically this is the timeline. And that's all I kept hearing was, typically this is X, Y, and Z. But it wasn't happening. I was trying to sit up. It was just too much. It was just really too much. And I'm not a sucker when it comes to pain. Like, so it was really like to that point. But the social worker came in and she said, you have to think, you're going from 100% healthy to now being down a whole organ. And your dad is going from not feeling great to now having 3 kidneys. So that was one of the things that I had to just prepare for. And yeah, so in the hospital, it took about 5 days. We wanted to be home for Thanksgiving.
Oh, I'm sorry to hear that the recovery was so eventful. Dennis, could you please unmute so I can ask you a question?
Okay.
The conversation now has to turn to lifestyle modification. What does that look like now that you have your 3rd kidney?
Well, feeling healthy and running around, you know, just.
So have you changed anything? What is different now compared to before? Know that you can run around, know that you can move around freely because of this, you know, at the time, maybe 20-year-old kidney as opposed to your very old kidney.
Yeah.
Know that you have a nice young kidney. What is changing in your life? What has changed in terms of your diet? Are you eating differently now in terms of your drinking? Are you drinking less? You know, I don't know what to ask you because I don't know. But the point is, how has your life changed in terms of what you do or don't do, what you eat or don't eat?
Well, dieting, I mean, I could eat. It's just the amount that I eat. So I mean, if you just try to eat less. I mean, no, my diet is not really strict. You just have to eat less. Less of what you love with this. You know what I mean? And I do still have a drink. But and I'm not gonna kill it. You know.
Yeah, one drink is good. One drink every month is good, I think.
Yeah.
One drink a month. I don't know what Dr. Mooch and Dr. Odetayo will say, but I think one drink a month is good. You talked earlier about, compliance or the lack thereof. You talked about prescription, insulin. That's what you talked about.
Yeah.
But I know that there is something called an anti-rejection medicine that you have to take after you do surgery. How is all of that? Because it seems to me, and Tiana, this is a question for you too. How is it? How have you adapted to taking all this extra medication? And I know you don't have a choice, but it still is an adapt. You have to adapt yourself to it. You have to make the change, whether you want to or not. I guess you have to. Tell me about that. Tell me about that change. First, Dennis, then Tiana.
Well, it's not actually a change for me because I used to have a lot taken anyway. I used to take medicine for the high blood pressure, for the diabetes. So it's just add a few more. It just had a few more that I have to take now. I mean, I used to have to take a Tylenol every day. So it had like I have now that I have to take for the rest of my life one, every day, twice a day you know, because that's the anti-rejection medicine. I have to take that twice a day, you know. But I mean, for the most part, I had a lot before, so it's not a lot of changes, you know, when it comes to that.
Okay, Tiana.
For my end, I don't have any medication that I have to take. I could only use acetaminophen. So, like how I was saying, with my physical struggles, that continued for a while, and all I can take was acetaminophen. So I documented me walking with a cane and everything like that, and being able to heal naturally. So if anything, I had a dietitian, and my dietitian was saying, hey, you need to eat this so you could keep your kidney healthy, because now it was all about prevention. So prevention to not be able to get diabetes, to have high blood pressure, to things of that, because it will put too much of a strain on the one organ that I have now. So my life just really went from, yes, I ate well, but it was just extra careful at that point. And really just dealing with a now pain to push through, and a lifestyle to push through, which actually affected my weight tremendously. I lost 15 pounds, and it was very hard to gain it back. So that was a big thing that I didn't realize, that weight insecurity was gonna come about. They were thinking, oh yeah, body image, but no, weight insecurity was a thing. And so in preparation, my medicine was acetaminophen. I also had a physical therapist and a mental therapist to help with my path afterwards, because it was a lot. And then also I still have nerve damage in my leg from the surgery till this day.
Okay. And you, when you were an athlete, what did you specialize in? What were you good at? What sports were you involved
I
in?
played collegiate basketball.
Oh, basketball. Okay. I just wondering if it was like running and all of that, if it's affected you
In high school it
everyday life.
was, in college it was basketball, and then after college I actually wasn't active. Like, people thought I worked out, but I didn't. So that was also part of the recovery of, I wasn't already active. So that was something that had to, you had to reincorporate. Yeah.
Okay. Thank you for that. Thank you. And I'm getting my notice that I am 8 minutes away from the end. So I just wanted to ask some quick questions as we close. Looking back again over the entire journey, what would you, Dennis, say to other Black families trying to understand or navigate the risks, the benefits of, organ transplantation? What are your thoughts?
Well, first of all, you gotta be, if it's got to be a close knit family for anybody who's gonna do that, because it's just a remarkable sacrifice. To tell you the truth, it's nothing, you know, nothing short of a miracle. Because I mean, if it wasn't for her, who knows? I could be still on dialysis right now. So that's one of the things that your family you gotta be really family oriented, and just we all have to be close, because if you have a family that here and there and there, no one is gonna really step up, and whether they could or not, they're not gonna step up. So it's all depends on your family, and that's how I see it. I don't.
Okay, thank you. No, it's a good way to see it. You lived it, you know it. Tiana, what are your thoughts? What would you say to Black families trying to understand or navigate this donation recipient organ transplantation process? What are your thoughts? What would you say to them?
I would start by just saying, don't let fear stop you from exploring the possibilities. Not that was my story, but that was a lot of people's story, and fear really could have entered into my mind, but it didn't. So the second part of it is being resilient. Pre, during, post, like it's a full journey. And to my dad's point, having a support system around you, I mentioned my immediate family, which everybody stepped up, especially when I was in Boston. I essentially lived back in my parents' home for 2 months, and you know, aunts, uncles, sister-in-law, well, not sister-in-law at the time, now sister-in-law, brother, like everybody pitched in, and then like I said, chosen family. So my parents' best friends, and then when I got back to Connecticut, my friends, everybody just stepped up. And I was actually happy. And the last thing is to not be afraid to share your story, because that was one of the things that I did 2 weeks after I shared it on social media. And it was an overwhelming response for who was inspired, who was like, oh my gosh, like, we needed this story. Like, this really got me through tough times. So much so that we got a donation from someone that I had met maybe once in a club, and we were friends on Instagram, and he actually mailed us $1,000 to
Wow.
help. And I gave it to my dad for his medicines, because he was 29 medicines at the time. So just don't be afraid, and be open to sharing your story, because you never know the type of impact you'll be able to have on somebody else's life. Even till this day, almost 5 years later, people are still thanking us and referring to what we did, and how that has been pivotal with their journeys.
This is so heartwarming, so positive. And I just want to say the obvious, that I believe that your relationship can only evolve positively. It just, there's just no way. There's no way it can go any other way. And I am so happy for both of you. I am happy that you are willing to tell the story. I'm happy that you're willing to be vulnerable. I am happy that both of you are here. I really am. I really am. And when I heard about the story, I said, this story has to come to Canada. It just has to come to Canada. And, there's no, what you call it, coincidences. I don't believe in coincidences. None of us, three of us here, believe in coincidences. I know this. And there's a reason why things happen. And I just want to wish you both, the best as you move forward in your respective lives. And again, thank you. Thank you so very much for being here and for speaking through love. Speaking through love. Thank you. So at this point, sorry, were you going to say something?
I was just saying thank you.
Okay. At this point, I'm going to invite Dr. Odutayo. I don't know if I didn't. Oh, there, I see him. Dr. Odutayo, I'm going to invite you to ask a couple questions if you would. But first, let me just introduce Dr. Odutayo so you know why he has been invited. He's an adult nephrologist, an adult kidney doctor, who will help us to understand the medical and clinical applications as we reflect on Tiana's and Dennis's story. Dr. Odutayo obtained his Doctor of Medicine degree at U of T, University of Toronto in 2013. A Rhodes Scholar at the University of Oxford, he completed 2 degrees, a Master of Science and a Doctor of Philosophy in epidemiology, and this he did between 2013 and 2017. His research focuses on clinical trials examining cardiovascular and renal disease, and is co-founded by the Kidney Foundation of Canada, the Ted Rogers Centre for Heart Research, and the Canadian Institute of Health Research, CIHR, Research Excellence, Diversity, and Independence Ready, their Early Career Transition Award. Dr. Odutayo, welcome. You have heard this wonderful story. Do you have any questions for Tiana and Dennis? And I want to be presumptuous enough to ask you to talk about the fact that Dennis did the surgery before doing dialysis. So that's the first one, and then you can take it from there. But I want you to speak to that. What does that look like in Canada? Is it even a thing?
So first, I just want to say a very, a thank you to, the committee for inviting me, and just, allowing me to, bear witness to this story. I think I probably speak for the majority of the people here in attendance. That was really special to hear about your bond and your journey through this, and you shed a lot of light for us, from the medical side, because there's so much that goes on in your own experience that may not come to the forefront sometimes in those short medical appointments. And I think it really, forces us to think a bit more about what every patient is going through and how we can best support them. So, and if I could even just draw some attention to some of the points that you made that really stuck out to me. I think you shared stories of strength and resilience, and really the challenge of making so much sacrifice in your personal life and, facing uncertainty, whether it comes to starting your own family. I was really struck by, I think it's amazing to hear, and reassuring to hear how well you were looked after throughout. But it sounds to me that even stories of seeing representation in your clinical team was a big part of actually also making this journey a little bit more seamless. I think sometimes we think a lot about the US and Canada, but it feels like from 2019 to 2024, all of our worlds had so much more in common when we had the COVID pandemic overlying everything, and really changing dramatically how we envision things. So, I think what you've shown us is that, there's probably even what you have in those settings, there was so much more similar in your experience and so much we can learn from your experience as Canadians, that our patients are going through. So I've been asked now to talk a little bit about the preemptive transplantation, which is where an individual receives a kidney prior to going on dialysis. And I think you actually alluded to this, Dennis, because you sort of contrasted your experience with that of your friend who went on dialysis first and then received a kidney later. And I come at this topic, with a lot of humility. I'm a nephrologist, but I'm not a transplant nephrologist. But nonetheless, with the experienced folk in kidney medicine, the point I think you were really making there, Dennis, was that when you go on dialysis changes your own physiology over time, and you continue to accumulate, poor health over time when you're on dialysis. And when you get a transplant, yes, it helps you reset, but you may not perfectly reset to before the transplant. And I think preemptive transplantation is really important because it allows you to sort of break that initial cycle of poor health and unwellness that happens once you start dialysis and the risks that come with it. So I'm really glad that that was the opportunity that you had. And, I think you saw that firsthand about what difference in trajectory it can make. It is something that we do have in Canada, which is really important and reassuring. But the challenge is finding a donor very quickly and having that donor go through the process. So I almost see it like a set of processes. The first is we actually have to identify people who have risk for kidney disease, and there are disparities in how we do that in the first place. The second is after we've identified people who have risk for kidney disease, we have to connect them with the practitioners and make sure that they have the follow-up and the monitoring and the education to know when they're coming to that stage where their risk for progression might be high. After we've done that, we then also need to offer the option of preemptive transplantation to people so they know that this is an option and they can go through that process. And as you pointed out, Tiana, it takes a while. Even without adding a pandemic, in your case, you had to travel between cities to get tested in different institutions and so on. So it takes a lot of time. There are large opportunity costs associated with it. So if you want to have a donor, that person has to make some sacrifices. If they don't have those unique social networks that you had, such as banking, sick leave, and so on, to actually make this easy, it can be quite daunting for someone to take on. So it's really important that we give people the time to prepare something like this so that they have the option of doing a preemptive transplantation. And then finally, if you do find a donor, and then that person is unmatched, or they can, engage in a paired kidney exchange, then you get the preemptive transplantation. So, it exists in Canada, but the barriers are very much similar in a way between our institutions and between our countries. And the final challenge we have in Canada is, and I'll invite Dr. Mucci to comment on this if he wishes, is we have the same challenge of getting a lot more representation from the African, Caribbean, and Black community into participate in transplantation and donation. And it's really important, as you said, sharing your story is an inspiration, and it'll really show other people that, you can go through this process and what the recovery is like and the difference that it makes in a lot of people's lives. So, to that first point around preemptive transplantation, I'm glad that your journey was of that nature, because I think it makes the biggest difference. And I'm glad that you're sharing your story, because I think we need to continue inspiring people and showing people that we can actually make a huge difference in the trajectory of health and wellness for people with kidney disease.
Do you have any other questions, Dr. Odetayo?
Yeah. So I actually do have a question about, your story, Tiana. You talked a little bit about, being very well supported during your donation process and also your recovery. One aspect of your story that stuck out to me, and I'm curious if you can tell us a little bit about how you navigated this, because I think it's an important learning point, not just for us as practitioners, but even for those of us who end up being patients in the healthcare system. You talked about your recovery and the fact that your recovery was slower than for others, and you had a lot of pain management challenges. And pain management is a complex field. It's something I personally don't think we do well enough in medicine. And historically, I think there's evidence that we don't do it well as well for people of, African ancestry as for other people. So you talked about advocating for yourself and speaking up, but how did that conversation go? How did you navigate that challenge when your recovery trajectory is different than everyone else, but you had to, in a way, convince people that what you're going through is real and it's not just an anomaly?
Well, as a Black woman, I've seen a lot of, hey, no one's listening to Black women when it comes to maternal health. So I wasn't at that point yet, but I knew that as a person, I did not want to swallow my pride by speaking up. I did lean on people in my family that had, and friends that had medical experience. So one of my best friends, she's a nurse, and I was telling her, she was like, "Hey, push through, but say something." And my grandmother, who's also Dr. Getfield's aunt, um, no matter what the doctors say, I also ask her, like, "Hey, what do you think?" And she was just kind of like, "No, you have to say something." So even with the whole recovery process, as I was getting opinions, I always made sure I referred to her, because I said, "Is this normal?" And she would also give a different perspective, because she used to be a midwife and a nurse.
Mhm. So that's really helpful. So it sounds like you really calibrated yourself against other people and you spoke up. And I think some of those stories that we've heard from other people, we always think about Serena Williams and other people who've been through the healthcare system and their voices weren't heard. It sounds like it also empowered you to know that, you're not going to sit on this and wait much longer if you're having trouble.
No, I didn't want to pass out or something bad happened to me on this bed. You know what I mean? And for them, they're like, "No, you had too much morphine." I'm like, "It's not working. We have to figure out something else." And it did force them to try to figure out different solutions.
That's great to hear. No, that's great to hear, and to hear that they actually were responded to your requests, and you leveraging your family and others to speak up for you, because I think it's one of the challenges. We don't do a good job of it, and and because we haven't done a good job of it in Black communities historically, as we try to push away and go to leaner pain management protocols, we're starting from a very low point in the Black communities in the first place, and we may be missing the fact that people are going through a lot of pain and this has important implications. And I know now you've talked about the chronic pain that you have with the neuropathic pain, and I think the burning you talked about in the nerve damage.
Yeah.
How have you found navigating that in the post-transplant period when people might say, "Oh, things should be better"?
Yes, they said over time it will get better. It still hasn't. I try to ignore it. I now have a very active 2-year-old, so he doesn't know that mommy's in pain sometimes, and he treats me like a jungle gym. But whatever you focus on grows, right? So I try not to focus on it. And, you know, I just keep pushing. And my husband's very supportive and he's always asking, you know, are you okay? How can I help? Is this bothering you? Are you sure you don't want to try to get another medical opinion to help rectify it? And at this point, I've just come to terms with living with it. And one of the things also I wanted to note in my previous answer is some of the residents listening to patients as well, because I had a resident that wasn't quite understanding my pain and what I was going through pre and post. So they had to go get their lead clinician to also double check what was going on. But yeah, it's just something that I lived through. If someone has a answer, I would love to know of how to help with this. But for right now, I just don't focus on it.
Mm-hmm.
And then, I see a question here. How is transplantation recovery time studied in persons of color or women? What are the recommendations as well too? I might leave that for Dr. Mucci to chime in a second if he's available. Just in terms, he'll know the more current data on that. One more question, Tiana, for you as well too is, and even also for Dennis, around, you know, you talked a little bit about mental health. And I think that came up more prominently, perhaps at the end of the journey. And sometimes I think, you know, for people who've persevered through so much, it's not till you get to the end that you kind of then you relax and then you actually start to think about how you've navigated through all that. As far as I understand, it's not something we necessarily always incorporate pre-transplant. But do you have any thoughts about whether pre-transplant, connection with? I know we connected with a social worker, but whether it's a psychologist or anything like that, do you feel like there's anything that could have been done, or we should be thinking about doing for our patients before they go through the transplantation process that might help them on the other end, with sometimes the mental health challenges that might come up?
Absolutely. Especially because I didn't really put a lot of attention on it. The social worker kept it pretty cut and dry and pretty surface level. However, she did say, hey, you may want to consider getting a therapist post. I would say get a therapist pre as well to help with that sustainability going into it. Before this, I really thought about how I was feeling during that time. My aunt, she actually had sent me a video of just part of my recovery. And I just remember feeling alone, feeling insecure, feeling just not whole. And had I not had therapy, that would have been things that would have continued to be challenging today. But I acknowledge how I felt, but then also having somebody to speak about it to was helpful as well.
Okay. I have one question that was placed in the Q&A. I'm going to read that one. And then Devron has a few that I'm going to ask him to read. And just about 1:40, we're going to ask Professor James to give his closing remarks. So I'm just giving people some timeline as to how we're going to move in the next half an hour or so. So here is the question. Well, let me read the entire thing. Thank you both so very much for being here. Tiana, you are truly an inspiration. And Dennis, it's been amazing hearing from you. As a Black student, passionate about advocating for health equity in African, Caribbean, and Black populations and other equity-deserving communities, what advice would you give to those of us looking to drive meaningful change? So what advice would you give to the students who wish to drive meaningful change and help address the systemic challenges in those communities that those communities continue to face? So first, I must ask, do you know what the systemic challenges are that Black communities continue to face in health? That's number one. And number two, what advice would you give to students and other persons, healthcare professionals who are looking to drive meaningful change and help to address these systemic challenges?
Me or?
You, start with you. And
Okay.
then Dennis can think about it some more.
So when it comes to the U.S. Systemic, maybe access to resources, as my dad had alluded to before, that's a big barrier, and then also just not having the people to really be educated enough to know what's possible, what's happening. But then when you talk about repeat the second part one more time, please.
Okay, so how do this student is passionate about advocating for health equity in
Yes.
Black communities? That's number one. So they want to know, what advice would you give to those students looking to change the system, to do things that will help to address the systemic challenges in the communities? So it's really just that. What would
Yes.
you do to help? What would you advise them to do?
Be the change you want to see. So be a part, learn as much, do all the research. Don't just read from a textbook or look at a screen, actually go into the communities, because that's the only way you're really going to know what people are going through, what needs to be changed. So when that patient is looking at you like, how are you supposed to know? No, I was with another patient 2 weeks ago while they were on the hospital bed going through this. So again, just immerse yourself and truly be that change, because it's going to be more genuine and more real, and you can actually apply it to your studies.
Thank you. Thank you. Dennis, do you have anything to add?
Well, ask a lot of questions, especially when you go to the doctor. You know, you have to ask a lot of questions and just don't say yes to everything they say. Question it sometimes too, because you never know. You just gotta ask. Whether whether you feel in pain or not. Because I've been to a doctor who tell me, I mean, and like Tiana was saying too, sometimes the intern are pretty good, because I've seen after my surgery, I was having this like a head cold, but it's not really a head cold. It's something to do with my sinus, and I went to the doctor, and the intern came in first. They asked me, and I explained to them what it was, and she says, well, we're gonna try to give you some antibiotic and stuff like that, and I think that was, to me, I think it was the right thing. But then when the doctor came in, he didn't want to do that. He wanted to send me someplace else, and and until this day, I still have that problem. So you do have to ask a lot of questions, and follow up. Be your own advocate of everything. Especially when you're of color.
Thank you. Thank you. Devron? Oh, and then Dr. Mucci.
Hello. Okay. So the first question we have here, I'm curious to know, before Dennis found out that he needed a kidney, how much did they know about kidney disease and transplantation? Is there anything else they wish they knew before going into the process?
I didn't know anything about kidney transplant or anything before, because I didn't have that to worry about until it started. Because even when at first when I start, when they start saying, oh, your kidney is going bad and stuff, I mean, I didn't even take it that serious, because I didn't, just keep doing what I was doing, and it get worse. So I really didn't, know much about anything until it comes down to that. When I start getting nervous now, it's like when they start sending me to go prep for dialysis. It's because when we do the surgery, I was just a couple weeks away from starting dialysis. It's not what So.
I see.
Yeah, and for me, the only thing I knew about transplants was that people wait forever to get one. and that a lot of times I was just seeing people pass because they couldn't get one. So that was just my only preconception to this whole process. I didn't really do a lot of research, and honestly, I don't think I would have done much research if I had to do it all over again. Because again, I don't want to, like I said before, I don't want to psych myself out or scare myself with anything. So I'm just like, all right, I take it one day at a time.
Okay. Okay. Thank you.
Thank you. Another question we have here, and I think I think in this case you may have misspoken, Tiana, but just to clarify, Tiana mentioned that she was told that the wait times for a kidney from a living donor could be 2 years plus. I'm wondering why it would take so long in the US. So I think in that case you were referring to a deceased donor taking longer than a living donor, but you could clarify.
5 to 7 years is the average
Yeah.
to be on the
So
list.
is that for a deceased donor, right?
For a living, for a living.
For a living. Oh, okay.
Yeah, for a living.
Okay, any more questions, Devon, or can we go to Dr. Mucci?
Yeah, okay. We have one more question for Dr. Mucci. I came in late, but was holistic methods of healing, has that been addressed or just traditional Western methods?
Did you try anything else? But you just said that you weren't even taking it seriously, so no, he didn't try anything.
Didn't try anything.
No.
No.
Dr. Mucci?
Mhm.
Thank you very much. I will be short so that Professor James can summarize what we have heard. I wanted to just go back to what Dennis said about the questions. That when you have health conditions and you go to doctors, ask questions. If you don't understand what they're saying, because frequently, unfortunately, we use words and language that is not easy to understand. And ask questions. The other important things about that is try not to go alone. Bring someone with you, because when you're not well, you may not understand things as well as if you were healthy. And when it's about you and your life and your kidney, well, the things are just buzzing around. And having someone who is a bit more cool head in that situation, especially if that person may be someone with a, so try to have those people with you and ask questions. Also prepare the questions ahead of time. Think about it, talk at home on the answer. So I think it is important, because knowing things help to cope with the situation, helps to deal with the issues. And I had a question also for Dennis. It's just you were not on dialysis, and you say you don't really knew too much about it. Have you ever had a surgery before?
No.
And were you not afraid of surgery? So how did you know that transplant will be better for you than being on dialysis?
Well, everyone, I mean, I always hear everyone talk about, dialysis it's just, you get, your body just deteriorates as you go along. So that was scary for me, really. Dialysis was scary. So, I didn't really want to go on it, but it was like inevitable. I had to, so, like I say, I was just weeks away from, starting. I was all prepped. Yeah. So.
And you were not very much afraid of surgery. You thought that, well, whatever.
You're not coming through very clearly, so
We are breaking up.
Yeah, sorry. I was asking whether you were not too worried about the surgery. You thought that, okay, whatever, let's the knife come.
Yes, I wasn't worried about the surgery as much as I actually was worried more about dialysis than the surgery, to tell you the truth.
Yeah.
Okay.
Well, certainly what you said about the dialysis, it's a good treatment for many patients because it keeps you going, but it is less kidney function that the transplant can give you, and body usually ages more quickly there. Coming back to the question that was asked about the holistic methods, we didn't talk about it. I don't think it was mentioned, but we don't know too much about those. There are no studies whether herbal medicine or other approaches to kidney disease early on or after transplant can help, and so we don't really know too much about those. So that's a different discussion that we can have at a later point, because I know that many people are interested in how else can kidney disease or other conditions be helped. And the other point I wanted to come back is this issue around recovery after surgery. It's not very well studied whether it's different in Black patients as opposed to others or whites. Certainly, in older Black patients in the US, it seems that there may be more complications after surgery. But it seems that if you if you have the help, and it sounded that Tiana had a lot of help after surgery, that helps to get the best possible outcome. But unfortunately, just as with anything, surgery or medication, even an intravenous, can give you side effects and complications. So sometimes things happen, and then you have the important thing is, as you said, that try to find out what can you do and what kind of help is available to reduce, to make it better.
Thank you, Dr. Mucci. Dr. Odutayo, you had your hand up, but it's now down. So your question or your comment was addressed by Dr. Mucci?
Yeah, exactly. He talked about the recovery question, so thank you.
Okay. All right. Thank you so very much. All right. Devon Swaby, I have Dr. James waiting to do the closing. So is it another question, or what is
Yeah,
it,
a very
Devon?
brief question. I'm just
Okay, go ahead.
wondering myself, as a child of a Jamaican father, Tiana, how much did you yourself know about your father's, diabetes and hypertension and kidney disease before it came to kidney failure? So before you got that call that, he's going to need a transplant, did you know of, the severity of things?
Oh yeah, I knew everything. Like he said, everybody in our family faces it, including my brother. And so when I was talking about who's gonna be the one, everybody had something. So so I was quite aware of what I was walking into.
Thank you.
Thank you. Okay, so now we'll invite Dr. Carl James, the Jean Augustine Chair at the York University, as well as the co-lead of the Caribbean African Regenerative Medicine Project. We'll invite Dr. James to give the closing remarks, about maybe 10 minutes or so, and then we'll invite Manuel to tell us what's happening next for CDTRP. Dr. James? You are muted.
Yes, sorry. Thanks very much. Thanks very much for the information that's shared and for the points that I was able to gather. There was a question also for Dr. Odulayo about transportation, and it's in the chat, but I guess that will come after. I'm very, very interested in the conversation and the discussion that we had here. I come to this discussion thinking of myself as somebody of Caribbean background with an interest of how racialized people, immigrants and others living in North America and in our society are able to get health benefits that will make possible the lives that we want to live. So hearing your stories raised a number of interesting questions and answered a number of very interesting questions for me. It was very, very, and what I listened to as I listened is what role did your background, namely being of Jamaican background, being an immigrant, might have informed the knowledge you had about diabetes, about the prevalence of certain kinds of these diseases among among people of Caribbean background, and how did you approach that, and so forth. And I got a sense that that was very knowledgeable. It was very much something that you understood to be in your family, etc. But I also wondered, and that discussion didn't happen, knowing that diabetes and all those things in your family, and probably another discussion at some point is, how then do you make decisions to give up a kidney, knowing that these things happen within the family? And so that's something I raised as well, because as the health team and as kidney specialists and so forth address and work with us, these are some of the understanding they would want to bring to us. One of the important thing that we also note is the role and place of work situation one has, how the work colleagues might be supportive or not supportive to that. We also hear about access to jobs and obtaining jobs. And when I think of this, I think of where do Black people in North America sit within the socioeconomic scale, access to jobs. And Tiana, you did say how you were shifting jobs. You talked about the job situation that you were in, and so forth. And then I think about those who might not, and this is very common among people of Black Caribbean descent, where they tend to be at the low end of the socioeconomic scale, tend not to have some of the jobs that we might that might be able to make possible the idea of giving time away so that you can look after family things. All those kinds of things need to be taken into account. And so it's not just simply the family and individuals that's going to be having to work with, or even the medical practitioner, but to think, how do we work that in the cultural understanding that people have? For example, I was very impressed with when your colleagues, Tiana, would say, okay, I have time that you can have. Or they were able to share that. And so that brings me to the other point of the place of social networks. And so those social networks are not only family members, but also and community members, but also colleagues at work. And so again, we're seeing how we cannot just simply think that this thing and what we're doing, whether it's to work through health situation or work through education, is purely an individual thing. What's constantly being reinforced is how we're all caught up. We all have a role to play in the outcome. And so what this also says, the fact that Tiana and Dennis are now productive members of society, members, it shows it's not only the individuals that benefit, but the entire society benefits because they are now able to make and continue to contribute to society. Contribute in such a way like now, most of us or many of us are now hearing how to understand, and medical practitioners are here now able to understand how they might want to deal with issues in this regard, and also what contributions they can make to make things different. Also, when we think of what's contributing to the resilience that Tiana talked about and Dennis talked about, is the role of a religious membership. And again, that also we must play a role because it's going to inform and influence how people move towards the system, and not only where health is concerned, but generally. Again, what was also significant in the conversation is the relationship to the health team, the connection you have had to the health team, and how the health team might be representative of people who understand you. There wasn't much discussion about that, but that's another conversation that I'll be very interested in how the health team might have played a role, or the significant role they might have played, given their representation or non-representation on how the cultural understanding or the understanding of the cultural background of you and the family might have played. Another significant piece that I think is also very cultural is the family network, the close-knit family or the family bond that exists. And what comes out here is how significant that is, and Dr. Moshe talks about when you go to the doctor, taking colleagues or friends with you or family members. That also talks about the significance of family. And of course, when I think of this and I think of the Caribbean background, is how significant family and you know, Tiana alluded to this. It's not just simply blood family we talked about. We talked about that extended family and the significant role that extended family plays in your social situation. And of course, I'm always interested in, well, is how understanding of that culture might come up in your health team. How much do they understand that, and how do they work with that? Because you know what you're asking health team too is also move out of this North American culture that we're so accustomed to, North American middle class culture that we're accustomed to understand the culture, the cultural ideas and so forth that people from other background bring. One of the thing that came up big in your discussion is not to be afraid. Again, fear, I think, is also very much part of the cultural baggage that we walk with, and how to not be afraid, and how to also demonstrate vulnerability, and so we bring all these kinds of armor. I would call them, when we visit the doctor or when we have a particular medical issue that we have to deal with. And therefore, our medical practitioners will have to also work with that. And so the communication between us and the medical practitioner is also significant. And while it might be easy for us to say, yes, ask questions of the doctor, and, you know, because it's your life. Yes, I totally agree. But at the same time, how the doctor receives that is also another part of the equation, and that's something that that's important for us to talk about. I think I should end here since I'm running out of time. But ultimately, then, what you have alerted to us to is how medicine and our relationship to medicine, the relationship to medical practitioner, also so forth, are very, very much. Not only, we just can't say it. It doesn't race, ethnicity, language, background from which we come. Should not be ignored. I'm very interested in one. Tiana was asked a question about. I'm forgetting the question. Yeah, I think you asked the question and you started by saying, as a Black woman, which also says that, you know, we bring ourselves, and that race is very much a factor in our experiences, and therefore we just cannot ignore it. So thanks very much for your contributions to my learning and to what all of us are going to benefit from tremendously.
Thank you. Thank you, Dr. James. The question that was asked that you're trying to remember is how much she has to fight. I think she has had to fight her entire life. So
and so that's why it's how she didn't respond. She had to position herself.
yes,
Because
yes,
how you had to fight, it's not without how you're positioned in society. Thanks,
exactly. Yes, we Black women have a different kind of fight. But just to respond quickly before Manuel comes, I want to say two things. And I thank you very much, Dr. James, for bringing them up. And this is something that I think bears a lot of conversation. Where Tiana and Dennis lives in Massachusetts, in Boston, is different from, I think, from where our 5 big hospitals are downtown. And therefore the racial composition, the cultural, ethno-racial and ethno-cultural realities in those areas, it's different from downtown Toronto, where we have a more non-Black, more white makeup of doctors and healthcare professionals. We have a lot of nurses who are Black and Filipino, but across the board, the hospitals seem to have a different composition completely in at Beth Israel, right? So maybe that is a part of it. I'm not saying that all the doctors are Black. I'm just saying that you have much more Black people, Hispanic people in that neighborhood. So it makes a huge difference when you go into the hospital. Because in terms of the doctor, you may see him once in a while, but you see the other healthcare workers much more. And when they know your story, they know your history, they share your cultural background, then it makes the experience so much more different from, I think, what we experience here in Toronto at the big 5 hospitals. So I think that's a good thing. And as a diabetic myself, yes, I belong to the family. We don't think about when we eat, Dr. James. When we drinking, we drink. And and Devron, yes, you're going to have a problem with your dad because we can't look at all of the things that we must give up. We have to live. Life have to live. And yes, we know we should be doing this and we should be doing that with all due respect. But when you look at it from the other side and knowing what we have gone through as Black people, it's a continual struggle every single day. We refuse to struggle with the food. We're not struggling with the food. When the thing come, when it come to bump, when things become bad, we will then address it, right? And so there's different ways of looking at it. So that's just my response, Dr. James, if I may, as to what could possibly have happened. How did we get to this point? I'm living it, so I know it.
There is a significant amount of work then that we're going to have to do with to change this Caribbean Black idea of how to engage. It's also significant, I think, that we're hearing from 2 Americans, and that also suggests that we have to do some more work here in Canada as well, really to also bring some of this understanding to our communities here.
Yes, I agree. I agree. And as the project manager of CARM, I agree. As Jackie Getfield, the diabetic, yes, I look forward to all the conversations. All right. Manuel Escota, who is the Patient, Family, Donor, Partnerships, and Knowledge Mobilization Director. Oh my goodness, Manuel. So Manuel takes care of the patients at CDTRP, and he'll give us, he'll tell us what's going on for the rest of the year, and in particular, what's going on in June. Manuel?
Excellent. Thank you so much for that introduction, Dr. Getfield. And as they always say, it really is a privilege working here with the Canadian Donation and Transplant Research Program, and specifically leading our patient engagement strategy, where we do put a focus on engaging patients, families, and donors in all our activities. And we do this because we need patients to guide our work. And really the goal of that is for them to guide change that really reflects community needs, change that's more equitable, more grounded, and more meaningful, as we've heard today. So I want to thank everybody for joining today's webinar. I also want to thank Tiana and Dennis for sharing your experiences with living donation and navigating the process. Dr. Getfield, you said it earlier, and I'll reiterate the point. It's really inspiring. It's very vulnerable when we get on these calls and when we hear from patients. And I think you both did a wonderful and magnificent job. So thank you for that. And just on that point, hearing from people with lived experience is always inspiring, but a little bit more than that. I think it's really essential. As we heard today, transplant recipients and families bring forward insights, experiences, and priorities that might not always be reflected in statistics. And it's really this human element, this human experience that has to be at the center of the work that we do, whether it's research, whether it's policy, for our healthcare providers out there, that serve us and that serve everybody, so the system can do better, as Dr. Patricia Gongol mentioned earlier. And this is where I put the plug in. If anybody wants to join and become a patient family donor partner, I really encourage you to click the links that were just shared. Thank you there, Marie Claire. click those links and explore how you can be integrated and how you can join, whether it's CARM or CDTRP, to have your voice heard as well. We're also sharing a link to CDTRP's patient portal, and that's a central hub of resources for patients, families, caregivers, and potential living donors to help you understand and navigate the pre and post transplant process again. So please encourage you to share those links. What I want to do is highlight the next session. So the next session of CARM's and CDTRP's conversations about Black health, about health in Black communities, will take place during CDTRP's Patient Family Donor Research Forum, June 12th from 12:30 to 2:30 Eastern Time. The session will explore the journey of Patricia McKenzie and explore the different treatment options for kidney disease. So again, thank you everyone for joining us. Thank you to all our speakers and for everybody who made this event possible.